Hello, this is Chris Hawk, and this is my comparative analysis presentation. As a captain in the Air Force Public Health Service, I've put this presentation together for the Public Health Unit officers that will be deploying to Mexico in the near future. The intention of this presentation is to provide an essential overview of the Mexican healthcare system using a variety of indicators to make this analysis. In terms of general overview, I want to give some background on the Mexican healthcare system, how it came about, some of the government agencies that are in play. In terms of general status, Mexico has what you would say is a mixed system, a mix of public health insurance programs, a mix of employer-provided health insurance and private out-of-pocket care. And there's also a series of kind of disconnected Social Security institutes that provide care as well. The current Social Security system offers healthcare services to employed individuals within the country and covers approximately 47% of the population as a whole. And health services for this population are provided through specific public hospitals and clinics. Now, according to the World Health Organization, universal health coverage is defined as having a program in place that ensures that all people in the country receive high-quality health services that they need without suffering financially as a result. So part of Mexico's major push, starting in the early 2000s, to achieve this designation of universal health coverage was the introduction of what's known as the Seguro Popular or Popular Health Insurance Program in 2003. Before this program was instituted, about half of the Mexican citizens carried health insurance, mainly through their employers. So there was a huge gap, 50% or more of unemployed Mexican citizens, or not necessarily unemployed, but underemployed, or in some sort of other form of independent employment that didn't fall under one of these regimes. So the initiation of the Seguro Popular was very important to kind of bridge this gap. And it provided unemployed and poor Mexicans with access to preventative health care services such as diabetes screenings, vaccinations, as well as treatment of chronic and severe illnesses. The program is supported, through a mix of federal and state funds, similar to how the Medicaid program in the United States for low-income Americans is funded. The poorest families pay nothing to join the Seguro Popular. The rest pay a premium based on their income, so it is a graduated fee-based system. By 2013, the number of enrollees in the system had grown to 55 million, which essentially enabled the country to achieve that universal health coverage designation as defined by the WHO. And that number was roughly the same number of Americans that were enrolled in Medicaid before the states expanded the program under Obamacare. So let's look at some key comparative measures here, how we kind of evaluate the program. The main 5 ones that we're looking at here are health benefits that are offered under the current healthcare regime, regional access to healthcare services, funding, quality, and health outcomes. So starting with healthcare benefits. Currently, there is the Universal Catalog of Health Services, which is also abbreviated, known as, the acronym is CAUSES, contains all of the health services to which the beneficiaries of Seguro Popular are entitled. And CAUSES provides a list of these comprehensive health actions called interventions, and they consist of more than 1,500 diseases and health activities that are covered under the regulatory regime. According to CAUSES, Seguro Popular offers 6 types of health interventions, including public health, prevention, outpatient care, dental care, emergency care, hospitalization, and general surgery. Seguro Popular also covers 284 health interventions for the first and second levels of medical care. Now, like with other things in Mexico, there is sometimes a little bit of a disparity between what the regulations state and what's actually offered. Mexico is known for actually having very good regulations, but sometimes not having the resources to enforce the regulations, provide the services that are spelled out in the regulations. So some criticisms that have come into place with the Mexican healthcare system and Seguro Popular in particular is that the package of services offered doesn't cover all the diseases that are commonly suffered by Mexico, and it also doesn't cover all the necessary diagnostic studies, medications, or surgeries that Mexicans need. Another criticism is that coverage under the program is actually limited, and the person who has the disease does not fall within the scope of the health package, has to cover the entire cost of his or her medical needs. So if you don't fall into any of these designated 284 health interventions, then there is a good chance that you won't receive coverage. And those are definitely some limitations to the benefits that are provided. Another major indicator for the healthcare system in Mexico is regional access. It's a fairly large country that has many areas that are somewhat geographically isolated. So it can be said that there is an inefficient regional distribution of specialized health resources. So you can say with some level of confidence that there's good primary care widely distributed throughout the country, but when it comes to specialized health services, not so much. For instance, only 23 states out of the 31 provide specialized treatment for breast cancer. Many of the current treatment centers don't have the necessary equipment to provide optimal care. And the quality of the treatment by the network of cancer centers under Seguro Popular is affected by the shortage of oncologists. So there are certain specialties in the healthcare system, such as oncology in Mexico, where there's a severe shortage of practitioners. And so that affects access as well. Specifically looking at local location and transportation issues, a lot of the time specialty healthcare services are very much centralized. So patients who would need cancer treatment have to travel typically to the capital of the state where these treatment centers are located. They're not widely distributed through the states, especially some of the more rural states. The cost of transportation and lodging, meals that come about through this travel can be prohibitively expensive and really creates a hardship for individuals. And you also see similar healthcare limitations faced by inhabitants with states with predominantly rural areas, like states such as Zacatecas, Michoacan, and Durango, where access to healthcare is seriously limited, chiefly by their geographic isolation and kind of inherent poverty within those states. Looking at funding, financial instability in the Mexican healthcare system is often created by insufficient contributions from beneficiaries and states. There's kind of uneven contributions throughout the country. 97% of the families enrolled in Seguro Popular are not required to pay because they're classified as poor. This is a good thing in terms of access to care for people who don't have the financial resources, but it also creates a gap in terms of funding the program. Further complicating this is the fact that many states reportedly, fail to provide their required contribution to the program. In terms of health protection investments, there's, considerable variability. Oaxaca invests more than 5% of GDP in healthcare, which is pretty high, but Nayarit, Zacatecas, Tlaxcala, and Baja California Sur invest more than 4%, but then you have a state like Campeche, which only invests 0.7%. Nuevo Leon's investment doesn't exceed 2%, and then Querétaro, Coahuila, and Quintana Roo's investment barely exceed 2%, with the national average being at about 2.8%. So you're getting kind of uneven contributions from the states. The rates of insured vary significantly by states. 5 states with the highest percentage of insured, Colima, Aguascalientes, Nuevo León, Campeche, and Coahuila, exceed 76%, but the national average is only about 65%. Then you have some lagging states where less than 6 out of 10 people had access to basic healthcare services. Quality, very important indicator of how the healthcare system is. Now again, going back, Mexico from a regulatory perspective has some great guarantees within their regulations. They've got the General Health Law, the National Crusade for Quality of Health Services, an Accreditation and Certification of Health Facilities Law, and a strategy to build integrated quality of care system. These are all relatively recent things that have come across, in less than the last 20 years or so. And they've been an important aspect trying to drive quality forward in the Mexican healthcare system. And in 2017, the Commission of Mexico instituted, alongside the Lancet Global Health Commission, a comprehensive survey of 320 quality of care leaders from local health secretariats and other facilities throughout Mexico. And they came up with a series of recommendations, reinforcing hierarchy for quality of care, reinforcing market perspective through purchasing regulation, reinforcing network perspective, creating a culture of quality of care. So again, in terms of intention and solid plans for going forward, there definitely are some pretty comprehensive strategies in place to improve quality. But how is that translated to actual quality increase? There's been some signs of improvement. Share of the population exposed to unaffordable or impoverished healthcare costs has fallen from 3.3% to 0.8% in the last decade. Key indicators such as infant mortality, deaths from heart attacks or stroke, as well as patient satisfaction rates have improved as a result of better access, especially through the Seguro Popular regulation. And there's been some groundbreaking efforts to keep Mexican healthy. They've instituted preventative programs like sugar taxes, food labeling regulation for advertising targeting children, and some other innovative policies. Mexico has recognized that as they've transitioned from developing to a developed country, a lot of their care does need to transition to more preventative care. And they have been kind of maintaining this in a pretty substantial way. So that's definitely a positive thing. Some challenges still remain. Rates of overweight or obesity within the adult population increased from 62% in 2000 to 71% in 2012. And now 1 in 3 children in Mexico is overweight or obese. More than 15% of adults have diabetes, which is more than double the OECD average of 6.9%. Deaths from heart disease have decreased by only 1% since 1990, which is a sharp contrast to other countries within the OECD. And the gap in life expectancy in Mexico and other OECD countries has widened from about 4 years to almost 6 years over the past decade. So there are some stresses on the system, a lot of challenges that remain in terms of quality. Finally, looking at just basic health outcomes, you can see the current life expectancy male-female. 2016 was 74 male, 79 female. Probability of dying under 5 per 1,000 live births was 13. Probability of dying between 15 and 60 years between male and female. Obviously much higher probability per 1,000 of population, 164 for male, 89 for female. Expenditure per capita, 1,120. Total expenditure on health as a percentage of GDP, 6.3%. Looking comparative health outcomes to other countries, United States, Mexico is currently ranked 61 out of 190 countries, whereas the United States is ranked number 37. Canada is ranked number 30. Life expectancy, 76.47 for Mexico, 78.37 for U.S., 24.2% for obesity for Mexico, 30.6% U.S. Infant mortality rate, 13.9% Mexico, 6 U.S. Death rate for children under 5, 6.8 for Mexico, 7.8 for U.S. So basically, the general takeaway, things are improving. We're getting to a better place. Mexico's a much more solid healthcare system in terms of access quality.